A very good day. This session I would be covering cholinergic agonists, or also called as cholinergic drugs. Therapeutically important drugs you need to know in cholinergic agonists are pilocarpine, bethanechol, methacholine. Now it's easier to remember bethanechol and methacholine because they have CHOL, that is signifies choline, and you have to remember pilocarpine. Now, the pharmacological actions of the cholinergic agonist is same as these parasympathetic effects, like, for example, meiosis, increased salivation, bronchoconstriction, decrease in the heart rate, increase in the GI motility, and as well as contraction of the bladder, and as well as defecation. Now let's go into the individual drug profiles. So let's begin with the first drug, that is pilocarpine. The most important point you need to know about pilocarpine is its therapeutic uses. Now the first and foremost important use is it's used in glaucoma. Now as you know, glaucoma is a condition where there is increased intraocular pressure in the eyeball. And pilocarpine is known to reduce this intraocular pressure. Now how it reduces intraocular pressure in glaucoma? Now in glaucoma, what it really does is it causes meiosis. As you know, when it causes meiosis, it frees the iridocorneal angle so that the iridocorneal angle becomes more widened. And due to increase in the iridocorneal angle, the outflow of aqueous humor is increased. That is, we call it as increased uveoscleral outflow. And because of this, it reduces intraocular pressure. Especially, it is very helpful in narrow angle glaucoma. Now, the most commonly used route for this condition is topical, that is, it's used as ophthalmic solution. Now, there's another special drug delivery system available for pilocarpine is called as OcuSert, which is nothing but it's an ocular insert, and this special drug delivery system releases pilocarpine at the rate of 20 microgram every hour for 7 days. The second most important use of pilocarpine is in xerostomia. Xero means dryness, stomia means mouth. So it is very useful in dry mouth condition. And here the route used is usually oral. It comes as tablets. And the most important conditions which is associated with dry mouth is post head and neck irradiation. And the second condition is autoimmune disorder, which is called as Sjogren syndrome. In these conditions, it's known to increase salivation and relieve dry mouth. And hence, the two most important uses of pilocarpine is glaucoma and xerostomia. Now, as far as xerostomia is concerned, there is better alternative to pilocarpine. The name of the drug is cevimeline. Now, cevimeline is M3 receptor specific. It has a long-lasting salivergic action, and it has a fewer side effects. And because of this reason, cevimeline makes a better choice than pilocarpine for treatment of xerostomia. Now let's move on to the next drug, Bethanechol. Now Bethanechol has mainly two areas where they are used. One is for the GI use and the second is the bladder. Now let's go with the first use. The first use is post-operative gastric atony or gastroparesis. Now Bethanechol is known to stimulate the GI motility by acting on M3 receptor. And due to the increased GI motility, it relieves the symptoms of stasis, like gastric atony or gastroparesis. The most commonly used route is either oral or subcutaneous. Now, subcutaneous use is mainly used post-operatively or for emergency conditions. Otherwise, for chronic conditions, oral uses suffice. Now, currently, Bethanechol is being replaced by prokinetic agents like metoclopramide, domperidone, which is found to be much better than Bethanechol. The second important condition where Bethanechol can be used is for urinary retention. As we know that cholinergic system causes contraction of the detrusor muscle and relaxation of the bladder sphincter, which helps in the voiding of urine. That's how Bethanechol is helpful for the treatment of postoperative, postpartum, chronic hypotonic, myogenic, or neurogenic bladder, where it helps to void the urine. As for any urinary obstruction because of the sphincter pathology, alpha blockers are the preferred drugs. So let me summarize the uses of Bethanechol. One is postoperative gastric atony or gastroparesis, and the second one is urinary retention. The final drug of this session is methacholine. Now, methacholine have not many therapeutic uses as such, like Bethanechol or Pilocarpine. The major use of methacholine is just for bronchoprovocation. Now, bronchoprovocation is a test used to assess the severity of bronchial asthma. Currently, this test is used for Olympic or in Olympic athletes to assess the severity of the bronchial asthma, and they should satisfy a minimum score for that. Now let me summarize the important side effects of cholinergic drugs. The important side effects include blurring of vision, salivation, precipitation of bronchial asthma or breathing difficulty, decrease in the heart rate, that is bradycardia, increased acid secretion, which can lead to peptic ulcer, gallbladder pain, tightness in the bladder. Now, finally, the conditions where cholinergic agonists should be avoided are bronchial asthma. Now, in bronchial asthma, it is known to increase M3 action, and it can cause constriction of the bronchial smooth muscles, which can precipitate bronchial asthma. Now, it should not be used in coronary insufficiency because it can cause hypotension and it can exacerbate angina pectoris or MI. Third condition where it should not be used is acid peptic disease because it can stimulate M3 receptor. Again, it can increase the acid secretion in the stomach and can cause peptic ulcers. And the last condition where it should not be used or with a caution is thyrotoxicosis. In the thyrotoxicosis, it's known to cause atrial fibrillation. This finishes cholinergic agonist. Thank you very much and goodbye.